Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Carbon dioxide absorber contains either a soda lime or paralime. Okay, what is most commonly used in India? In India, we have soda lime. In India, we use soda lime. So, what are the constituents of soda lime? It contains sodium hydroxide, calcium hydroxide, potassium hydroxide, silica, and dye. So, what does soda lime contains? It contains sodium hydroxide, potassium hydroxide, calcium hydroxide, water, silica, and dye. Okay, so the containers, that is the soda lime containers, have granules of carbon dioxide absorber instead of powders. So why do they have granules of carbon dioxide absorber? They have granules of carbon dioxide absorber because if you see the granules, they have increased surface area. The surface area of granules is more when compared to powder. So because of increased surface area, they have granules of carbon dioxide. Similarly, for free passage of air, if there is granules, then in between the granules there will be air. Free passage of air can occur between the granules. So for that free passage of air, we have started using granule. And if there is granules, this will prevent the dusting of gas. If there is powder, obviously the dust can also enter through the gas, and even that gas can enter the lungs of the patient, right? But if there are granules, these granules cannot cause dusting of the gas. So these are the reasons why we have put granules of carbon dioxide. One, to increase the surface area, free passage of gas, and to prevent dusting of gas, right? Now,
thank you and thank you for watching.